Hello, and welcome to this Foster Care Institute online training webinar. Attention Deficit Hyperactivity Disorder, ADHD, Part 2. Addressing and Treating ADHD. I am your host, Dr. John DeGarmo, founder and director of the Foster Care Institute. I am an author of several best-selling foster care books, an international speaker and trainer, and I have been a foster parent to over 60 plus children who have been placed in my home and with my family over the years. This is part 2 in a 2-part webinar series. If you have not watched part 1 of ADHD, I would encourage you to stop now and go back and watch part 1 before you continue with part 2. Over the years, my wife and I have had many children placed in our home who have been diagnosed with ADHD. And alongside that, we've also had children placed in our home who have suffered from ADHD but were never diagnosed with it. Our goal during this webinar is to increase your awareness of how to best address ADHD in youth and how to help them. You're going to increase your awareness of ADHD and how it impacts lives, as well as to gain understanding of how to develop and implement strategies designed to aid youth with ADHD. Again, this is part 2 in a 2-part series, and if you've not watched part 1, I would encourage you to do so now. Throughout this webinar, we're going to look at some quotes from some parents who have had children with ADHD. DS is one parent, and DS says this: picture a room with 1,000 TVs, with each TV showing something different. Now, try to concentrate on just one TV without getting distracted. Now, before we look at how to best help youth who have been diagnosed with ADHD, it is important to quickly review just what is ADHD. And this comes to us from part 1 of this 2-part series. So again, we're going to quickly review some of the main points from part 1 before we continue to find out how we can help youth with ADHD. So what is ADHD? Well, as you recall from part 1, ADHD stands for Attention Deficit Hyperactivity Disorder. It is a medical condition. A person with ADHD has differences in brain development and brain activity that affect attention, affect the ability to sit still, and affect self-control. ADHD can affect youth at school, at home, and in friendships. And this comes to us from kidshealth.org. The Center for Disease Control says this about ADHD. ADHD is generally diagnosed in youth by the time they are teenagers, with the average age for moderate ADHD diagnosis being around 7 years of age. And again, we thank the Center for Disease Control for this. Roughly, it is estimated that about 4% to 12% of youth have ADHD today. Boys are 2 to 3 times more likely to have attention deficit hyperactivity disorder than girls. Many studies, many researchers suggest that ADHD is indeed generational. It's commonly found in brothers and sisters within the same family. But were you aware of this? Youth in foster care Youth placed into the foster care system are three times more likely to have ADHD than children coming from traditional families. Let me read that to you again because this is quite significant. Youth placed in foster care, perhaps youth you are working with, are three times more likely to have attention deficit hyperactivity disorder than children and youth that come from traditional families. In addition, youth in foster care who have experienced trauma are often misdiagnosed with ADHD due, in effect, in part to the trauma they have experienced or the trauma they have suffered. Let's look at what another parent says. Living with ADHD is like walking up a down escalator. You can get there eventually, but the journey is exhausting. And this comes to us from parent K.E. More than 1 in 4 youth between the ages of 2 to 17 who were in foster care had received an ADHD diagnosis. And this is compared to about 1 in 14 children in Medicaid. Going on, among youth with an attention deficit hyperactivity disorder diagnosis, those youth in foster care were as likely as others to be treated with ADHD medication, but were more likely to have received psychological services. And about 3 out of 4 youth in foster care with ADHD while in foster care placement received some sort of psychological care. Indeed, perhaps this goes in accordance with the youth that you are working with. The Centers for Disease Control tells us this. Youth with attention deficit hyperactivity disorder, or ADHD, those youth diagnosed with ADHD who were in foster care, who were in a foster care placement of some kind, whether it's a residential home or a therapeutic home or a traditional foster care setting. These youth were also more likely to have another disorder. And roughly half of these youth were also diagnosed with conditions such as oppositional defiant disorder, or ODD, depression, and or anxiety. Now, this is compared to about 1 in 3 children with ADHD and Medicaid who were not in the foster care system. And again, this information comes to us from the Centers for Disease Control. Now, before we go any further, it's important for us to recognize this truth. And we've said this here similarly here at the Foster Care Institute several times. But we're going to twist it just a little bit here. Those youth that you are working with, those youth that you're caring for, those youth placed in the residential home who suffer from ADHD, they're doing the best they can. They are doing the best they can. They're trying to hang on. They're trying to survive. They're trying the best they can. And it's important for us to remember that. So, we examined briefly the highlights, if you will, from the first part of this 2-part webinar series. What exactly is ADHD? And again, we go into much more detail in the first webinar. So how do we help? How do we help youth placed in foster care who are diagnosed with ADHD? Well, to begin with, it's important for us to not take the behavior personally. For those youth who have been diagnosed and suffer from attention deficit hyperactivity disorder, who are challenged by this disorder, who struggle with this disorder, and they may lash out, they may struggle, they may become angry, they may become disorganized, they might not be focused. And if they should in any way lash out towards you, it's important and essential that you do not take their behavior personally. We've said this here several times with the foster care. It has nothing to do with you. It has everything to do with the youth and the challenges that they're struggling with. It has everything to do with the youth who are struggling with this diagnosis. When they're lashing out, or when they're acting out, or perhaps they're having anger management issues and it's directed towards you, keep this in mind. It's that. It is being directed towards you, but has nothing to do with you. It has everything to do with how they're being overwhelmed with the challenges they face due to their diagnosis. So once again, do not take their behavior personally. It has nothing to do with what you've done or who you are. When you are reacting and responding to youth that you're working with who are diagnosed with ADHD, avoid yelling. Avoid being aggressive towards them. Even if they are yelling at you, even if they're being angry towards you, even if they're showing some aggression towards you, you need to avoid doing so in kind. Instead, lower the tone of your voice, lower the intensity of your voice, and use very, very simple words. Do not go into complex, full explanations or sentences. Instead, talk very simply to them, lower your voice, and lower the intensity. One parent said this: because ADHD is not a visible medical disorder, people don't understand that it's just as disabling as those that are very visible. It requires understanding and acceptance that people with ADHD need some accommodations at times to perform to their potential. Let me read that last bit there. People with ADHD need some accommodations at times to perform to their potential. And this comes from a parent who wishes to remain anonymous. When you're working with youth in foster care who are diagnosed with attention deficit hyperactivity disorder, make sure that you remain in control. You should be in control of the situation. They may be lashing out, they may be having one of those very difficult moments, but it's important that you remain in control. We talked a little bit earlier about lowering the intensity of your voice and not yelling back. It's important that you regulate your own emotions. Remain calm. Be patient. Be compassionate. Be caring. Be understanding. Be patient. Be generous. And be the loving adult figure that every youth wants, every youth needs, and every youth deserves. Now, there are various forms of therapy that youth in foster care who struggle with ADHD can have that will benefit from them. To begin with, there's behavior therapy. Now, behavior therapy begins by using behavior changing strategies, such as perhaps token reward systems and time in for dealing with difficult situations. We mentioned time in. Time in is a form of discipline when misbehavior occurs. Now, when a teen or youth is placed in time in, the teen is placed and remains in close proximity to you. Time in allows the youth to be close to you or an adult staff member instead of away as in time out. Time in and time out are quite different. Time out might have the child or youth isolated, perhaps standing in a corner, perhaps in a different room. Time in has the youth near you. Youth are likely to feel their needs are being considered when they're placed in time in. There can be a connection of some kind between the staff and youth before a correction is presented. Youth are given time to properly process their range of feelings the range of emotions. Now, time in might look like this. Time in might have the youth sitting at the kitchen table while you are working on a computer or perhaps folding laundry. Time in might have the youth sitting on a couch with you in the room. Time in might have the two of you sitting together at the table, perhaps working on a puzzle together, perhaps reading together, perhaps doing homework together. Time in might have the youth sitting in a chair or a couch while you are performing other activities in the room. Time in allows the youth to be in the same area around you instead of isolated. That isolation might give the youth the indication or the feeling that they're being shunned, that they are being pushed away. Now, staff and providers do not feel out of control or create a power struggle to keep the youth in the timeout. If the youth is placed in the room, a different room or in a corner, so to speak, the youth might struggle to remain in that timeout situation. When the youth is in time in, there is no power struggle, if you will, because the youth is going to be around you. Again, the youth does not feel isolated, does not feel shamed, or does not feel scared by being placed someplace different. When placed in time in, it gives the staff, you, and the youth an opportunity to talk about the real issue at hand when the time is right, when the time is appropriate. Perhaps after the youth has become calm, or perhaps after the anger issues have surpassed. For much more on time in, we do a deep explanation about it in the book, The Foster Care Survival Guide. And I encourage you to pick up a copy of that book for much more on time in and so much more. Other forms of therapy include family therapy. Family therapy can help both the parents and the siblings understand what ADHD is, how it affects the entire family, how to best deal with the stress of living with a family member that has attention deficit hyperactivity disorder. Let's look at what another parent said. It's magic and fire all rolled into one. My son is bright and energetic, yet easily frustrated and distracted. It is a constant battle to help him, to get help from others, because so many are ignorant on the issue and think ADHD doesn't exist. I accept my son as he is and think his ADHD just makes his world that much more colorful. And this comes to us from parent RB. The youth that you're working with, do they seem to be easily frustrated? The youth that you're caring for, that are living in the residential or therapeutical setting and home, do they seem easily distracted? If so, perhaps they have ADHD. Another form of therapy is psychotherapy. This form of therapy allows youth to talk about the challenges and stress that he might experience and that he might suffer from. Along with this, it helps youth to learn ways to best address and best help when they struggle with their attention deficit hyperactivity disorder. Now, perhaps you do not have the opportunity for psychotherapy or family therapy with a therapist at the residential setting that you work with, but there are other forms of therapy that you can do right there where you work, right there at the home. There's dance. Perhaps you have, or the residential home has some type of dance group or dance lessons. This can be very therapeutical for those who suffer with ADHD. Music is a wonderful form of therapy for those who struggle with challenges and emotional issues anger management issues, attention deficit hyperactivity disorder. Art can be a wonderful way for those to express themselves when they're struggling. Play therapy. Those who struggle with ADHD might be able to best help themselves by going outside and playing basketball or catch. Animal therapy, simply petting a cat or a dog or a rabbit or a soft animal, can be very therapeutical for those who are struggling with attention deficit hyperactivity disorder. Indeed, when a youth who struggles with these issues pets an animal, it's very calming, it can be very peaceful. The youth with ADHD can talk about their challenges and their struggles and how they're overwhelmed without any type of feedback, without any type of criticism. Indeed, all the animal does is sit there and listen. Again, these are forms of therapy that you can have right there in the home. Extracurricular activities can be very therapeutical and very helpful for those youth who struggle with attention deficit hyperactivity disorder. Indeed, try to encourage the youth that you work with, the youth who live at the home, to join extracurricular activities at school, perhaps, or in groups, maybe sports, maybe drama, maybe music, maybe clubs. When they're focusing on these type of activities, it helps them to build their confidence and it helps them to focus better. And when they are performing music or drama, and when they show art or when they're engaged in extracurricular activities, is so important. In fact, it's critical that you praise him for the courage to do so and for any attempts and successes that they might have. We talked earlier about how it's important that you remain calm. It's also important that you help the youth learn how to bring calm to them during a challenging time. Help them develop breathing techniques. Help them develop relationship skills. When the youth is struggling, when they seem to be angry or they're distracted, tell them it's okay to feel this way. Tell them it's okay. And give words to their emotions. You might say something like this: I see that you are angry. I can hear in your voice that you seem to be a little bit overwhelmed. I see that you're a little bit distracted right now. You're giving words to their emotions that can better understand what they're struggling with. Now, to be sure, every teen needs to hear words of affection and love on a daily basis, particularly those youth who have experienced abuse, neglect, abandonment, particularly those youth who have experienced trauma and are filled with anxiety. So remind those teens that you're working with how important she is, that she's cared for, that you are grateful for her, you're thankful for her special attributes and for her gifts. Now, when it comes to showing affection on a personal level, make sure that you do so in an appropriate fashion. If you're unsure or unclear what an appropriate fashion might look like, talk to your supervisor about what is appropriate and not appropriate in regards to showing affection towards the youth that you're working with. Hey, we all love to be praised. We all love to be thanked. We all love when someone recognizes the work that we're doing. This goes the same thing with the youth that you're working with. Catch them in the act. Catch them in the act of being good. Don't catch them in the act of making poor choices all the time. Instead, catch them in the act of doing the right thing. Catch them in the act of good behavior. Look for opportunities when the teens that you're working with are doing the right thing, are behaving in a positive fashion, and praise them for doing just that. Say things like, hey, thank you so much for helping with the kitchen. Thank you so much for keeping your room clean. Hey, I just want to let you know I'm really grateful for your attitude today. Hey, I know how hard you're struggling with right now, and I'm just grateful for your positive attitude. Hey, I am so glad to see you today. Hey, thank you so much for allowing me to help you with the laundry or whatever it might be. Catch them again in the act of being good. I noticed that your room is really tidy. Thank you for doing that. Hey, wow, you did a great job with dinner earlier tonight cooking it. Thanks for doing that. I'm so appreciative of that. Wow, I happened to be outside and watching you petting the dog. That animal really does love being around you. Again, catch them in the act of being good. Don't always look for times when they're misbehaving or making poor choices. Catch them in the act of being good. There is a saying, windows are the eyes to the soul. Eye contact is so important when helping those who struggle with attention deficit hyperactivity disorder. At every opportunity, at every opportunity, look youth in the eye with a smile and with words of encouragement. Let your positive attitude, let your positive energy, let your enthusiasm, let your optimism, let your love and compassion shine through your own eyes. Our eyes are expressive. Make sure that your eyes are expressing positive attributes. We talked a little bit about finding ways to catch them in the act. Find ways and opportunities to praise youth in every way at all times. Again, youth in crisis, youth in foster care, youth in general need to hear words of praise about them and to them every single day. And there is a list there, right there, of how you can do that. Now, teens with attention deficit hyperactivity disorder often feel that they're letting other people down. They may feel that they're letting you or other staff members down. They may feel they're letting their supervisor down. They may feel that they're letting other youth in the home down. What you need to do is focus on their strengths, which no doubt they have plenty of strengths. We all have strengths. We all have weaknesses. Find his strengths and focus on him and focus on those strengths. If he's unsure of what his personal strengths are, and it's very likely that he might be, again, he feels he's letting other people down, help him discover what his strengths are and find ways to use these strengths in everyday life, whether it's at school, at work, at play, in the home. Perhaps his strengths lie in cooking, maybe sports. Maybe he's very, very artistic. Perhaps he's great with electronics or computers. Maybe he is very good at gardening. Perhaps he has wonderful social skills. Maybe he's excelling in school and education. Whatever it might be, help him discover those strengths, find ways to use these strengths in everyday life, and praise them for those strengths. This goes a long ways in helping those who feel they're letting others down. Now, it's important that when you're working with youth who have ADHD, that you're reasonable and realistic with your expectations. We talked a little bit about various forms of therapy, including time in. Don't expect therapy and treatments to quickly fix everything, to quickly resolve all the issues. In addition to this, we talked a little bit also about being compassionate and loving and caring. Don't expect that simply loving the teen to be the quick fix either. Again, be reasonable, be realistic with your expectations when you're working with youth who have ADHD. Many times, those who suffer from attention deficit hyperactivity disorder struggle with social skills. Now, we know how important social skills are in order to successfully thrive in society, whether it's in the workforce, at school, whether it's at the home, working with others. Help him learn important social skills. When you help them to learn important social skills, saying hello to others, using good manners, speaking clearly, being polite, when you're helping them learn these important social skills, this helps them to better respond in an appropriate fashion to others at all times. Those youth who are in crisis, those youth who have suffered from trauma, those youth who are living in a foster care environment need positive role models. Perhaps you're coming from an environment where there were no positive role models. It's important that you recognize that you are a role model. The teens you're working with, the teens you're caring for, the teens living in the home setting, they're watching you. They're listening to you. Always. Morning, noon, night. They're watching you. They're listening to you. So it's important that you be the positive role model for him. You be the role model for him on how he should act, how he should react, how he should respond, how he should treat others, how he should treat himself. If you are yelling at him, then why is it not okay for him to yell at you? If you show frustration and anger, then why can't he do the same? If you're spending all the time on your phone, then why can't he do the same? Remember, he's learning from you. He's listening, he's watching you. You might be the very first positive role model he's ever had. So make sure what he learns from you is positive. Now, youth need routine and youth thrive on routine, particularly those youth who are diagnosed with attention deficit hyperactivity disorder. Routine is very helpful. So put in place in the home defined routines. Routines for the morning, before school, after school, before bedtime, and try your best to stick to those routines. When youth who have attention deficit hyperactivity disorder know what the type of routine is, know what the expectations are in the morning, getting up, showering, getting dressed, brushing teeth, combing hair, having breakfast, putting the dishes away. After school, coming back from the school to the home, washing hands, doing homework, preparing the meal, cleaning up, study time, whatever it might be. When they have these routines in place and know their expectations, this helps a long ways with those who struggle with attention deficit hyperactivity disorder. In addition, allow them to be part of the routine. Ask them what they would consider a good routine, or ask them if they think this is something that they can do. At the same time, there are going to be times when you need to be flexible with your routine. Perhaps a basketball game comes on the TV that he really wants to watch. Perhaps there is a special event in the community that you want to take the youth to. Perhaps there's a birthday party or a special movie. You need to, at times, be flexible with your routine. Now, those who struggle with ADHD, you can help them by avoiding difficult situations. Those youth you're working with most likely have suffered some type of trauma. Try to avoid those difficult moments for them. Identify what might be a difficult situation for him and try to avoid placing him in a difficult situation. We talk a little bit more about this in our trauma-informed training webinars, and I encourage you to check those out. Youth who struggle with ADHD really are helped by organizational skills. Organizational skills can help youth with ADHD. Help him to learn how to organize his clothes, to keep his room clean, how to organize his school materials, how to organize his life. You may have to be hands-on. You may have to help him organize his clothing, organize his room, organize his school materials. You may have to help them in the beginning, and that's okay. When it comes to schoolwork, help him set up a quiet place for him to do his homework. Gather materials for a homework spot. Materials may consist of pencils and pen and paper, perhaps a computer, books, etc. Organizational skills can go a long ways in helping those with ADHD. Try to avoid the teen's room being cluttered. Try to avoid his homework area being cluttered. Instead, make sure his room is organized and clean. Make sure his homework spot is organized and clean. Everything put away in its spot. When it's disorganized, when it's cluttered, then he can be overwhelmed. He can be overwhelmed and not know how to get the area cleaned up because he's overwhelmed by the clutter. A healthy lifestyle goes a long ways in addressing those who suffer from ADHD. Youth who struggle with ADHD need regular sleep, and they need plenty of it. In addition, a healthy diet and eating habits goes a long ways as well. Finally, exercise and good old vitamin D right from the sun are also ways to help those who struggle with ADHD. So again, plenty of sleep, a good healthy diet and eating habits, and lots of exercise. Youth in foster care are generally 18 months behind academically while in school. Youth in foster care often struggle with reading and math skills. Those youth who transition or age out of foster care, 55% most likely will drop out of school. And as a result, will end up homeless and end up incarcerated. Thus, it is important that they need an advocate while in school. You are their advocate. Make yourself known to the teachers. Make yourself known to the counselors and administrators. Share the contact information with the teachers and counselors and school administrators. Ask for other schoolwork when needed. For much more on this, check out the book Helping Foster Children in School. Remember, they need you to be their advocate. When it comes to medication for ADHD, to be sure, medications can be used to treat behavioral concerns. Again, to treat behavioral concerns. The real work, though, the real healing, though, is done through various forms of therapy. Now, anytime at all that you give medication to the youth that you're working with, any type of medication whatsoever, even if it is pain reliever or cold medicine, cough medicine, medications for their ADHD, whatever it might be, to begin with, make sure the doctor's been consulted. Make sure you have the supervisor's permission. And finally, make sure you properly document medication. Document what medication you gave, how much you gave, the time you gave it, the location you gave it. Documentation is key and critical when giving any type of medication out. Now, to be sure, there are alternative forms of medication. These include yoga, meditation or prayer, special diets, avoiding fatty acids, vitamin supplements, and herbal supplements as well. Again, when you're giving vitamins or herbal supplements, make sure that you consult with a doctor and make sure you consult with your supervisor beforehand. Now, when you're working with youth who are suffering and diagnosed with attention deficit hyperactivity disorder or ADHD, it can be exhausting. It can be emotionally, physically, mentally draining. So it's important as you care for the youth, at the same time you care for yourself. Take care of yourself. Give yourself some timeouts if needed. Give yourself a break when needed. Make sure you are taking care of your own diet. Make sure you are getting plenty of sleep. Make sure you're getting plenty of exercise. Because if you can't care for yourself, it is going to be impossible for you to properly care for youth with ADHD. Finally, do your own research. Do your own research on ADHD. Read books about ADHD. Watch videos or webinars online. Listen to podcasts. Attend classes. Finally, talk with others. Talk with some of your fellow staff members who have cared for youth with ADHD. Talk to your supervisor. Talk to some of your friends who may have children diagnosed with attention deficit hyperactivity disorder. Learn from them. Finally, I'll leave you this quote from another parent. Once diagnosed and treatment started, the changes have been incredible. Math, multitasking, and overall cognitive abilities have increased many times over. What was once almost impossible for me is now effortless, and I find ways to improve daily. And this comes to us from LM. For much more on this and so much more, check out our website, Dr. John DeGarmo, fostercare.com, or the Foster Care Institute. If you don't already, please follow me on Facebook at Dr. John DeGarmo, the Foster Care Institute, where I'm posting information several times a day related to foster care and parenting. Follow me on Twitter at Dr. John DeGarmo. And finally, if you have questions about this webinar or anything else I can help you with, please contact me via email at drjohndegarmo@gmail.com. I mentioned this book earlier, The Foster Care Survival Guide. This is a great book that gives you many, many wonderful tips, hints, strategies as you care for youth in crisis. And there are several other best-selling books here at the Foster Care Institute. I'm sure there's one right now that's a perfect fit for you. I want to thank you for watching this webinar. I want to thank you for taking time to learn more about how you can help youth that you're working with who are diagnosed with attention deficit hyperactivity disorder. It's a challenging disorder, not only for the youth who suffer from it, but for the friends and family members and for staff members. With these tips, you are going to be better equipped to help these youth, not only now, but for their future. So thank you. Thank you for all that you do to help youth in crisis. Thank you for caring for youth in need. For the Foster Care Institute, I'm Dr. John DeGarmo.